Hi there everyone, this is Keith from the National Alliance of Mental Health and Substance Abuse Recovery. In this video we're going to go over how to taper drug use. First of all, I would like to note that this is a rough guide. Always consult a trained psychologist or physician before deciding to taper. Failure to do so can lead to relapse and or worsening of pre-existing health conditions. With that out of the way, we shall now begin. You may be asking, what is tapering? Tapering is where you slowly decrease your dose at a steadily lower rate. The end goal is a near entire removal of the body's dependence on the substance that you require, and a complete or near complete stoppage of the withdrawal symptoms that you would have if you were to stop on any other occasion, and that is a result of the near entire removal of the body's dependence. So what drugs is tapering useful for? Tapering is useful for nearly all drugs, but mainly used with opiates, benzodiazepines and alcohol. However, when using tapering for benzodiazepines, it's very important to note that benzodiazepine withdrawal can be fatal because it can induce seizures, and as a result it is highly advised to go and get help from a professional when tapering benzodiazepines. So how is it physically done? It is mainly done by decreasing the amount you're taking each week by a certain percentage. It is done with a certain percentage because this means that the amount you're decreasing each week will decrease. This means that you'll slowly get an exponential curve. Why is it done this way? It's mainly done this way just to reduce the withdrawals that you will experience. These figures will illustrate exactly what I mean. Here you can see that in the first week you're taking 100 milligrams. If you decrease that by 5%, it then goes down to 95, a difference of 5 milligrams. However, if you decrease that 95 by another 5%, you're only going down by 4.75 milligrams. Obviously these would be very hard to weigh out, but it shows the concept very effectively. Here I have included an exemplar taper dose schedule. This here is actually quite a fast taper dose schedule because you're reducing it over just 6 weeks, and the amount that you're tapering it down by does not really decrease by a huge amount. As you see, at the end of it, you're taking 2.5 milligrams one day, nothing the other, and another 2.5 the next. Eventually, the intention would be to taper off entirely and abstain from using the drug if at all possible. I will now touch on the topic of replacement therapy because it's very popular in the UK and it's up and coming in the US as well. What is replacement therapy? Replacement therapy is when you substitute a street drug you're abusing, for example heroin or Xanax, for a pharmaceutical grade opiate or benzodiazepine, for example methadone or Librium. So why would one do this, you may ask? One of the main reasons is the fact that it is much easier to calculate doses. This is because of the fact that street drugs are impure. That in and of itself isn't a huge issue, but the issue is that one batch of a drug will differ in potency from another. This means that you cannot scale down your doses accurately each week. That makes it impossible to taper. Replacement therapy also significantly reduces the chance of relapse and morbidity. So how do you start? Begin by contacting your doctor, GP, or the doctor who prescribes your medication that you wish to taper from. If you are going to go through your doctor, they should refer you to a doctor or practitioner who specialises in replacement therapy and who can prescribe you with the drugs that you need. From there, you will be helped on to maintenance therapy, from which you can taper off entirely and abstain from using drugs. Thank you very much for watching. I hope it was informative and or useful for you. If you're in a tough spot, feel free to talk with us. You can find us at Reddit at the link www.reddit.com/r/mental-health-watch or at Facebook at www.facebook.com/groups/alliance for mental health. Good luck!